So, unwanted pregnancy is a nightmare for everyone, and one should choose a method of contraception wisely. I am Dr. Manju Khimani, working as Senior Director at Max Smart Super Specialty Hospital, Saket, New Delhi, and I'm going to talk about contraception today. Many women are unaware that these days even female condoms are available. They protect you against pelvic inflammatory disease and sexually transmitted disease. So if you've finished your family and if you want a permanent method, one can go for tying of tube or ligation. But you must know that it's a permanent method. Tomorrow if you want to have babies, it cannot be reversed and you may have to go for IVF. So if we talk about reversible contraceptive method with good efficacy, oral contraceptive pill is one of them. But you have to take this pill starting from the third day of period every day for 21 days. Biggest advantage is that your periods are very regular, they're very scanty and they are painless. But you cannot take these contraceptive pills immediately after delivery in the first 6 months when you're breastfeeding. After 6 months, even if you're breastfeeding, you can take these pills. So if you do not like the idea of swallowing a pill every day, you can go for intrauterine contraceptive device, or popularly called as COPRT. COPRT is a very small device which can be inserted inside the uterus immediately after delivery, or one can also insert it in the OPD. Insertion does not require hospitalization. This device has a very little failure rate. The biggest disadvantage is that in 20% patients they can have heavy bleeding and it may require removal. But remember, in 80% patient will have absolutely no problem and they are very happy with it. But if you are suffering from heavy periods and if you want a contraceptive, then a very good device, popular device for you is Mirena. Mirena is a very small device which has got hormone inserted in it. This hormone is released every day, 20 microgram every day. The biggest advantage of Mirena is its failure rate is very little as 0.2%. It causes very scanty bleeding and absolutely painless bleeding. It's very popular abroad. But if you do not like the idea of getting inserted anything inside your uterus, then you should think of getting a device inserted inside your arm. This is called Implanon NXT and now it is available in India. It's a 2 inches rod, plastic rod, which is inserted in your upper arm and it works for 3 years. Its failure rate is almost zero. So choose your method according to your age and according to your needs. But what I would suggest, you should consult your gynecologist who will be the most appropriate to tell you about the pros and cons of every method. I hope you found this video very informative. In case you have any questions or queries, please drop them in the box down below. Thank you very much for watching it.
Subscribe to our YouTube channel and press the bell icon to get the latest healthcare updates.